Hello, Dr. Alexia.
What brings you to my office today?
Well, I've been having some interesting stomach issues lately.
What are your symptoms?
Well, I've been struggling with vomiting and nausea, belly bloating, pain. I get full really quick when I eat, acid reflux, not wanting to eat, and lots of weight loss.
Well, your most recent labs show that your glucose levels are off and that you have malnutrition, which we weren't concerned about before because that's occasionally present in some people. But with your other symptoms, I'd like to send you to specialists. Okay, so after a few minutes with your chart, it appears you have gastroparesis. And I can confirm this with an upper endoscopy, upper GI series, CT scan, MRI, and abdominal ultrasound. Which would you prefer?
You said I have gastro what?
Your stomach is paralyzed, so you don't pass food anymore, and it sits in your stomach until eventually you expel it.
Well, I think I'd prefer the MRI. Well, doctor, what's my diagnosis?
It appears that I was correct. Your stomach has stopped all muscle function and does not allow for proper digestion anymore.
So, what caused this?
Well, most gastroparesis cases, between a quarter and a half, are labeled as idiopathic, which means healthcare providers couldn't determine the cause. And for you, I couldn't either.
Okay, well, is there a treatment?
We have some options. Medications could be useful to stimulate your stomach, but may not work with your case of severity. Nutrition and hydration therapy via constant IV, and surgery to disengage your sphincter, so the thing that stops all the food from flowing. Specific treatments for the condition that causes your gastroparesis could help, but it's not soon enough, and without the underlying cause, I don't think it would be best for you.
Okay. I think let's try nutrition and hydration, and let's see how that works.
Okay.
Well, doctor, is it working?
I don't think so. Because you're still having some of your symptoms, we should try and stretch your pyloric sphincter.
I feel so much better now, but will I need the surgery again?
No, the surgery only needs to be performed one time.
Thank goodness.
24 hours after the surgery, you should have started a liquid diet and transitioned to soft food at 5 days post-op. I would like to check in with you in 4 weeks before you transition back to a standard diet. So you've been on baby food textures for about 5 weeks now. How's that been going?
It's been going pretty well. I can tolerate larger quantities of food now.
What symptoms do you still notice?
Well, instead of constantly feeling full and constipated, it's more like it goes too fast through my system and I have diarrhea.
That's a pretty common side effect. I'm just happy to hear you don't have stomach pain or nausea. To relieve the number and severity of your bathroom trips, I would like you to spread out your meals. So do snack sizes 6 times a day instead of those 3 large meals that most people do. And you should try and drink at alternating times of your food so you don't overload your stomach.
That sounds great. Thank you. I will try your recommendation.
I'll see you in a few months to make sure your recovery is still smooth, but it's pretty normal after you turn to a typical diet. Has everything been going well since we made those dietary changes?
It has. My diarrhea has alleviated, and since I started the low-fat options.
I'm so glad to hear it. I no longer need to see you at this point, so good luck, and you can always reach out to me if